This is part 5 in a series titled How Good Is Your Doc? And again, there's some of this on trying to figure out your doc, but it's really more focused on you. And we've covered diabetes, we've covered lung disease, we've covered malnutrition. Today we're going to cover vascular disease. Now the whole channel is about vascular disease. What's the goal here? We want that to not become this, or even worse, this. Pardon me for the disturbing images. But here's the performance that you tend to see. In terms of documentation, docs who are focused on prevention and who are obsessive, who are making sure they document what's going on with you as a patient and discuss it with you, they'll find 75% or more. Now this is in a population 65 and older, and actually that every one of these green bars is with the higher performance docs because they're finding disease more often. But that, like most of the numbers, even that 75% is low. Now, let's go back and talk about this condition, these numbers, what all this means. Now, is this to beat on your doc? No, it's not. It's to help you, again, not end up having a very bad problem with your health. Again, the things that most of us tend to think about in terms of saying, is my doc going to be really good at prevention? You think about where he or she trained. You think about their verbal skills. That's really, you think about how nice the office is. And all of those things are usually about the only thing you know or you are able to look for. But actually, as I mentioned before, quite often the biggest thing is the environment that the doctor practices in. Number one, I'd go with a bigger practice. And I don't mean 5 or 10 or 20. I mean a large organization, because these kind of statistics, these numbers come from large organizations. Now, what kind of organizations am I talking about? Just to give you some perspective on my background, I started off as an ER doc. I worked at Hopkins for a while. I trained at Hopkins, worked at Hopkins for a while, went on to be the CMO, Chief Medical Officer, for a lot of companies. One was MDLIVE with over 800 docs. Another was Premise with over 500 clinics focusing on primary care and prevention. I've also been senior medical management at some Medicare Advantage organizations as well. And speaking of Medicare Advantage, that's a great place to go if you're in the Medicare environment. A lot of people think, oh, that's cheap, that's for people that can't afford the real Medicare. I want to go to my own solo practitioner. I wouldn't do that. I wouldn't do that for me as a patient. I wouldn't recommend that for my family, and I don't recommend that for my patients. There are a couple of things about Medicare Advantage. Number one, the Medicare is actually compensating docs for doing this, doing prevention, picking up disease before you hit the doc in the face with it. And number two, as I mentioned before, a solo practitioner, even a 5 or 10 practitioner practice, is not going to have the resources to create these statistics, to find these statistics, to put these where we compare docs to each other, which is exactly what was done in these numbers. So again, that's what I'm trying to help you do, help you understand, the best places to consider getting care, and these are not places that you would usually consider to get care. Number two, we're talking about each of the clinical areas. So again, how to take this and keep it from becoming this, or even worse, that. And again, it's like it is every time in the preventive arena. You got to remember the iceberg. If your doc is waiting for something to hit him or her in the face, he or she's just looking for the tip of the iceberg. And that is not safe. We all know that. That's it's an outworn or a worn out analogy. You know, it's interesting with docs and vascular disease specifically, especially in the older populations. It's yes, it's grossly under-recognized because for the most part it's asymptomatic. But it's not that docs don't know that you have it. In fact, most docs assume that everybody, especially Medicare age and above, everybody has it already. And it's like the yellow water, you know, that they swim as a fish. If a fish is swimming in yellow water, it doesn't impact his life. Now, why do you want to know that? Again, you're not necessarily, you're wanting to remain healthy. The role of diabetes, again, almost all of this is due to not so much prediabetes as it is, not so much diabetes as it is prediabetes. Prediabetes is the major cause of cardiovascular inflammation or vascular inflammation. It burns the intima, the media, or the intima, the endothelial lining, the slick lining of the artery. And when it does that, LDL slips out of those holes, the burns, the cracks, and lodges in the intima-media space. Now you know where I'm going with this. How can you find that out? How can you prevent that? It's fairly simple. Get a CIMT. And for those, we've talked about CIMT. We've done several videos on it. We've done a series on it. We've talked about the statistics, the research behind it. And again, it's a painless procedure. There's no radiation like you get with coronary artery calcium scores. And as if that mattered for the population that we look at anyway. And you can do it serially. You can do it over and over again to see how much your, A, how much plaque you have, and B, what kind of impact your prevention activities are having on it. As I said, we're looking at arteries, we're looking at intima-media thickness, and we want to keep those arteries clean. Thank you for your interest.